Right. Awesome. Thank you so much. Well, we're going to go ahead and get started, ladies and gents. Welcome back. We are halfway through the first day of the People of Color Living with Diabetes Virtual Summit. My name is Quisha Omemba, President and co-founder of Diversity in Diabetes. I'm excited to introduce our next speaker. This is probably one of my most anticipated topics for the day. And we have with you today Gazania McCoy, who's going to be talking about how traditional Chinese medicine can benefit people living with diabetes. And I want to give her as much time as possible, so I won't read her bio. You can find that inside of the VFairs platform. I'm going to go ahead and pass the baton, for lack of a better word, over to you, Gazania. And it looks like someone else is excited for this session as well. So tell us why we should put needles in our bodies.
Okay, let me share my screen.
Okay.
Okay, so can you guys see the screen?
We see it, great.
All right, so acupuncture and how traditional Chinese medicine can benefit people living with diabetes. So I just want to briefly, let me get on here. Oh, did it skip over?
It went, go back one.
Okay, perfect.
Okay, there you go.
Little glitches. I want to skip over. So I want to explain a little bit about myself and my background. I am a founder of a wellness center here in Oakland, California, near San Francisco. And I am a certified board licensed acupuncturist and herbalist. I have a master's degree in traditional Chinese medicine from the Academy of Chinese Culture and Health Sciences. And in my clinic, I focus on treating women's health, pain management, and diabetes support. I am certified to teach diabetes education classes through Script Diabetes Institute. It was called Project Dose. And then also I have a diabetes certificate from the Association of Diabetes Care and Education Specialists. And just a little also background, I taught diabetes education classes for about 2 years at a community health center here in Oakland, California, and I also facilitated support groups. So just to give it also personal background of myself, the reason why I am so passionate about this topic of diabetes is because 12 years ago, I was diagnosed with type 2 diabetes. So this is something that is I have a passion for helping people with. So yeah, that's my little background right there. So what will we discuss? So I want to discuss first, what is acupuncture? Then also the type of training that we get as acupuncturists, because a lot of people don't necessarily understand the kind of training we get. And then I'm going to discuss 6 branches of our medicine. So we don't just stab people, right? We don't just put needles in people, but there's also other branches that we do as acupuncturists. And then a lot of people, maybe many of you have not received an acupuncture session. So I want to kind of give you an overview of what to expect at a session. And then number 5, explain diabetes from a Chinese medicine perspective. So sometimes the jargon is a little different. We approach it differently. So I'm just going to kind of explain it from a Chinese medicine perspective briefly. And then number 6, the good part that everybody would like to also want to hear about is how acupuncture and traditional Chinese medicine can benefit people living with diabetes. And so we're kind of going to go over how it improves insulin resistance, how can it help with diabetes distress, peripheral neuropathy, high blood pressure, fatigue. And sometimes when I taught the class, everyone's favorite was sexual health. Because it affects us, right? Both men and women. And then at the end, why you should include a licensed acupuncturist as part of your diabetes care team. So what is acupuncture? So I know you guys probably saw maybe a model of an acupuncture body that have all these different points in the body, right? So acupuncture points are specific areas of the body just beyond the skin of the surface, and it's where they have high concentrations of nerve endings, mast cells, lymphatic vessels, and capillaries. So when we insert needles at particular points, and we're trained, of course, there's hundreds of points, it stimulates the sensory receptors, which in turn stimulates the nerve, which then it transmits impulses to the hypothalamus, pituitary, and adrenal system. So basically, this complex system is something we call feedback loop. So between the brain, the hormones, and the glands, it's responsible for regulating, of course, our body processes, right? So this acupuncture helps to regulate this feedback system. So we say like it actually helps to heal the body, but kind of creates homeostasis in the body. So this is something that's really amazing and unique to this medical system, which is a medical system that's been used for over 3,000 years. And it's the Chinese were very well at documenting everything. So this is the kind of stuff that we study in school and learn. So this is like a full medical system, right? And if we look to the side, move this over, you kind of have a graph of how acupuncture works. So you kind of read and look at it, but generally what you kind of basically need to know is that acupuncture promotes, like I said, homeostasis and healing of the body. And it really influences these systems, the nervous system, the cardiovascular system, the endocrine system, and the immune system. And these are important. And I know that you guys can download my slides. So if you want to further look at that, you can. The next is briefly acupuncturists and the training that we receive. So, and well, I'm licensed in the state of California, but throughout the United States, it's mostly everyone has to have like a master's degree. And in our master's degree program, you have to have at least 3,000 hours. So it's about a 4 to 5 year training. And then you get about 1,000 hours of clinical work, of working in a clinic and working with patients. So most times, right, a master's program is probably 2 years. So some say, oh my gosh, why is your master's program 4 to 5 years? But because it gives us, we have to go over so much information. And like I said, like it says here, we cover the Eastern part of the medicine, but then also we're taught the Western side of the medicine. So we're taught about Western medications, lab works, and then also, Western diagnosis, so that we can effectively communicate with the primary care doctors, the endocrinologists, and still in the state of California, we are considered primary care. So this is a heavy responsibility. So we are that because we are trained well. And then if you see the scope of the practice, this is kind of a general idea of what we can perform. Like we can order lab tests, we can interpret x-rays, and also, of course, acupuncture, prescribe herbs, and engage in nutritional counseling, stuff like that, right? And so I do want to make a little bit of notes toward the bottom part that medical doctors and chiropractors and physical therapists, they can also practice acupuncture, but it is with reduced hours. Like maybe they take a weekend course or they have like a 80-hour requirement, but this is not the same as learning the medicine, like the training that I've received. There is more of just something we could call dry needling, where they just stick some certain points, but it's not the full theory of diagnosis, checking the tone of the pulse, and really getting the gist of what this type of medicine can really do. Just to put that out there. Okay, so my next slide. Now we're going to talk about the 6 branches of Chinese medicine. So this is important because we don't just stick needles in people, right? We don't just stab them. It doesn't feel like a stab though. But so this is from the branches. So the first one is meditation. So acupuncturists were trained to help teach people how to breathe properly. We give them advice. And so when that, of course, stress affects our glycemic levels. So this is something very important that we want to inform, especially patients with diabetes, about meditation. And so this is part of what we do when you come to acupuncture. So we also prescribe some ways to help with your breathing, depending on what we find, what's going on with you, right? And so then second is Chinese nutrition. So this is very important because in our medicine, food has different energetic properties. So depending on when we have a consultation with you, we check your tongue, your pulse, we ask you questions. So you may have different deficiencies, as we say, like kidney deficiency, stomach deficiency, liver deficiency, something like that, right? And we translate that into, okay, depending on what you have, these are the foods that we would recommend you to have because they have these energetic properties and they can help you. So it's truly a holistic approach. And we don't treat everybody the same. So you may have a form of diabetes, but every person has, in our thinking, every person has it for different reasons. So that's why we address them, right? We address them based on your particular need. And then number three is medical Qigong. If you see that picture at the bottom, you see people in a park. Sometimes you may see like, what are they doing? They're moving, are they worshiping the tree? But that's what I thought at first, right? But medical Qigong is really an exercise. You do different exercises to help stimulate different meridians in your body, right? So we have the lung meridian, the heart meridian, the kidney meridian, all these different organs. So the important things and the key thing about this is if you have a deficiency, we're saying your kidney meridian, the practitioner will give you exercises for you to help support that system. So that's one of the meridians that that's one of the things that's beneficial of the 6 branches, the medical Qigong exercise. And so number 4, one of my favorites is number 4, and that's herbs. I was really drawn to this medicine because of the herbs, the smell of the herbs, the effects of the herbs, and then a little backstory with myself personally. I got into this medicine because when I was a young teenager, I would have periods like twice a year. That's not good, right? No, that's not good. So they wanted to prescribe me birth control and stuff like that. And my mom was like, oh my goodness, girl, we're not going to do that today. So I saw an acupuncturist, got herbs, and then was able to regulate my cycle. So herbs are powerful. Like I mentioned right here, herbs are very powerful. They're just as powerful, just like pharmaceutical drugs. That's why we have to be trained on how they affect different people. So especially if you're on certain Western herbs, we have to consider that because some herbs you can't prescribe people because they have an effect on either your heart medication or if you're on blood thinners. So we have many books to reference to make sure that we keep you safe. And yeah, and so the next one is acupuncture. And so of course, you guys already know what that is. We place needles in certain parts of the body. So that's one of the branches, the 5th branch. The last one is Tui Na. This is a form of body work, and it originated in China. And the thing is, it follows the acupuncture points. And so when you come see me, like if you come see me or other practitioners and include it in your session, I would do like Tui Na body work on these points. So if we find a deficiency somewhere, I'll palpate and like I knew it was going to be sore. Like, oh, how did you know? Because based on looking at your tongue and pulse, I can tell that maybe your spleen meridian is deficient. And so I will palpate and just try to help that. So it feels good too to see an acupuncturist. Believe me, you'll feel great. So what to expect? I'm not going to read all this, of course, but what to expect at an acupuncture session? We do a history intake. We view blood work because for us, we look at different blood work, of course, like your lipids, your A1C, all these things, right? And for us in our medicine, if your blood work is like kind of either too high or too low, it tells us something as far as Chinese medicine. So that's why we look at it in that way, so we can treat you better. And then we take vitals, we check your tongue and pulse. Again, checking your tongue can help us determine what's going on the inside. And so I know you're probably gonna look at your tongue after, or maybe look at your tongue right now. If you go look in the mirror, just because I see a lot of people with type 2 diabetes or just, type 1, or even gestational diabetes, if you stick out your tongue, most people with diabetes usually have a crack in the middle of the tongue. I'm not going to go into detail of what that is because I can explain, and it's going to take forever to explain everything about the tongue, but you have this crack in the middle of the tongue. I see Casey just, but yeah, but that tells me something too. But we can like talk about that a little later. And then also the pulse tells me something about the health of your organs. And then we do like, based on that, I create a plan, and then we do nutritional counseling and prescribe herbs. So this is like a treatment plan. So it's individualized. And so when you see the rest of this, the slide, sometimes acupuncture can give you a little bit of fatigue after a session. This is because you were shifting and removing things. So this is something called like a healing crisis to a certain extent. So you may feel a little tired. So I tell patients, go home, rest, and nourish yourself. And then they probably feel a lot of energy the next day, which is a good thing. And sometimes you may feel a little sore. Very rarely you get bruising at the site, but sometimes it can happen. And then within a couple of days, it's fine. And then also the last one says emotional release. And working with a lot of people with diabetes, this is sometimes happens a lot. So somebody would, during a session, cry because they have this built up, emotion and stress about dealing with the chronic disease. Or sometimes they laugh, and this is an emotion too. So this is a good thing. This tells me that there's shifts happening in the body that needs to happen. So, you can talk to any doctor. Of course, we're not just mechanically looking at a person, but there's an emotional component. And sometimes that can affect our health, our thinking, and, our blood glucose numbers. Because, when you get mad, you've been fussing at somebody, you check your sugar, it's like, whoo, through the roof, because it affects us, right? So real quick, I'm talking about tools we use doing an acupuncture session. So I have these pictures here, and you probably, if you've never been, like, what is she doing? Is she burning somebody? Is she scratching somebody? No. So this is a cup. Of course, you see the picture. We use cupping, and we like put a fire in and put the cup on the body, or we can do a suction tube. Sometimes this is helping with pain, but then also sometimes it's not pain. It's really effective with as far as asthma. And then if you put it on the back of the patient, there's different organs connected to different areas of the body. So sometimes if someone has, let's just say a liver deficiency, right? And when you cup their liver area, then you have this big, sometimes you see different marks. So it tells us about what's going on in the body, and it helps stimulate blood flow and the immune response. And that's what we believe is a theory, and what helps. And then also we have a moxa. You see the picture right there where someone is not burning them, but it's a smoky moxa. This is what this is. This is an herb, and it's called, it's an herb called mugwort, but we burn it and then we place it to give it a little stimulation to the point. This is really effective with energy. And I'm later going to talk about that because research have shown moxa and moxa needles really help with energy. It's a more, I can give an explanation of it, but that's a whole nother topic, but just give you the basic. And then we use like a gua sha tool. You guys probably saw that. It's in the picture right there, but you're kind of scraping. We use the gua sha tool. And then the infrared lamp right there with the lady laying down, we use that to help with inflammation in the body. And it's not just for pain. Sometimes, especially with people with type 2 diabetes or diabetes in general, they have inflammation. And then we have inflammation markers that show. So this also helps the body. This helps the body. And then we use needles, herbal oils, and electrostimulation. You see that at the bottom. Okay, let me go over this slide right here. Now, this is a brief explanation of diabetes from a traditional Chinese medicine perspective. Now, sometimes our wording is a little different. So I don't want to sound too foreign to you all, but that's why I said from a traditional Chinese medicine perspective. So before I speak on this, I'm just going to give you a brief little illustration of how we look at things and how we view it. So I want you to imagine a forest where there's an area where it's a drought. We'll say there's a drought. So let's say from a Western medicine perspective, they would get a pipe, get some water from a river or ocean, bring the pipe in there and then put it where the dry part is. Now it's lubricated. So that's what they would do. That's effective and that's fine, right? That's just a different way of approaching it. Now with traditional Chinese medicine, our approach is different. It's like, okay, so we have a dry drought area. Let's look at the trees. Is there something wrong with the tree? Do we need to add something to help grow it better? So it takes us a little time to get that water back in there, but because we're looking at the environment, we're changing a little bit of things. So it takes a little bit of time, but we still achieve the same goal. Maybe not as fast, but we do it in a more natural way and more homeostasis way with allowing the body to do the work, right? And a little bit of, so that's our approach. So we're like a complement to each other. We can complement each other. So from a perspective of traditional Chinese medicine, let me move that up because I can't see. So diabetes patients have a combination of what we call qi, which is energy, yin is like the fluids of the body, and deficiency, dryness, and heat. So you're like, okay, we're talking about dryness and heat. And when we say this, like sometimes heat signs like someone has they're hungry, they're excessively hungry, or maybe they're constipated. So these are just how we approach it. So the majority of people with diabetes have a pathology we call Taiyin or Shaoyin. I know you don't know necessarily what that means, but Taiyin is pertaining to the spleen in the lungs, and then Shaoyin pertains to the kidney and the heart. So of course, with most people with diabetes, they have higher glycemic levels. So in our medicine is due to failure of the spleen transformation. And in type 1, it's failure of the spleen transformation due to the spleen not being supported by the kidneys, right? And so in type 2, it's due to direct damage to the spleen by diet or emotional factors. And so this is kind of like a base, this is really basic. It goes down to deeper, but I'm trying to not be such of a TCM nerd. I'm sorry. So this is a general idea. And so our aim is also to help regulate glucose levels and correct these imbalances, right? Every patient's a low gym. So our idea is to correct these imbalances. And so if you notice at the bottom, let me see what it says right there. Of course, we include diet and exercise are important, but you know what? Weight loss is not necessarily important. You know, sometimes like weight loss, boom, 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 weight loss. But the key is to find out if a body is in balance, its natural weight, it will be its natural weight. So that doesn't necessarily mean there's a, you can, if I don't lose X amount of weight, I'm not healthy. But if everything else is fine and normal and working properly, the tongue is looking great, the pulse is great, your energy is great, I don't care about how much you weigh. We don't care about how much you weigh. It's more of getting your body back in balance. And so our goal is to try to, to do that. And of course, tight management of the blood glucose and improving these pathologies that we find, it will help. And so at the bottom, I have, move that over a little bit. I do have some of the principles that we use. Like it says supplement kidney. You're like, what does that mean? We do acupuncture points we know to help support kidneys. We use herbs that we know to help support the kidneys. We use meditation practices and qigong, stuff like that to help support the deficiency that we find. I hope that wasn't too much for y'all. It's just, okay. And so now, how acupuncture and CCM can benefit people living with diabetes. So, oops, my scroll. Okay. So researchers have been interested in assessing ways besides medication to address diabetes management. And recently, there's a lot of studies. So at the end of the slide, I do have a list of studies that you guys can look at because I love to show evidence-based information, of course, of how acupuncture, they evaluate the effectiveness of acupuncture. And so this particular one study, it showed that there was a weight loss of like about 9 pounds, and it showed that the markers of the blood sugar, insulin levels, and the insulin resistance all improved with acupuncture. And then also like their blood the blood fat, the cholesterol, and the inflammation markers also improve. And so, we all know that these are factors in helping to manage diabetes. And so one, and particularly therapy that we also use, especially with people with diabetes, is electroacupuncture. And I use that myself when I treat patients in my clinic. So just to give you a brief little story, I see a lot of patients who have type 2 diabetes mostly in my clinic. But of course, before the treatment, they have their machine, they check their sugar levels, right? Sometimes the patient come in, they check it, and before the session, their number is like 210. 210. Okay, like, oh, 210. But and then after I do the treatment, I do what they need is stimulation, and then they check their sugar. And one patient, after just 30 minutes of the treatment, her sugar got down to about 130, right? And she's like, wow, like I go exercise for like an hour and my sugar is not that. So there's something to, of course, this electroacupuncture and then particular points that we use. And it's really, yeah. And so, oops, I skipped over that slide over there. And so, yeah, acupuncture has really been effective in treating the diabetic neuropathy, managing blood glucose levels, and improving insulin sensitivity. And so that's what we are going to talk about next. Kind of like how does it improve insulin sensitivity? So when we do acupuncture treatments, it helps to stimulate the pancreas, to help stimulate better function of the pancreas. So we have protocols to help with the endocrine system. There are some points in the ear that we use. It's called the pancreas point, right? And then we have an endocrine point. And then also, I usually do like a pancreas point, an endocrine point, and liver point in the ear to help stimulate that. And that's why you say, well, how does she help the person to acquire better blood glucose levels just doing this treatment? Because these are points that we stimulate, and it helps. And then also, oops, sorry, just over here a little bit. It helps to, studies have shown it helps to improve the endocrine function. And also research has indicated that acupuncture treatment can help reduce fasting and after eating blood levels, increase insulin production and reduce insulin resistance. And then also there's a study that I have later on the slide. It shows about how combining treatment with metformin has been shown to be more effective for insulin, increasing insulin sensitivity than metformin alone. So it's really a medicine that can be combined as part of someone's diabetes care plan. And we also know that diabetes is stress. That is a major thing. And to be honest, I didn't even know about this when I first, I didn't know what diabetes distress was until I actually learned about it and then start teaching classes. I'm like, I thought I was tripping all along. Let me stop. But it's really good to know that now I'm aware of this myself, and I tell other people with diabetes that it's okay. This is something we have to, people don't understand that when you have been diagnosed with diabetes, this is something that you have to deal with every single day. Every single day, it's on your mind. Like what I eat affects me, how I feel affects me, and that is sometimes taxing, right? It's sometimes taxing on the body. So how can acupuncture help, right? Acupuncture is really known to help with relief of stress, emotions, like it says, whether it's emotional, cognitive, or behavioral, it really helps in reducing stress. And this is something that's key that we need to do, especially while we're living with diabetes, to help stimulate these hormones so we can stimulate the good hormones, right? And reduce the bad hormones like cortisol that really help, that makes us get all, makes our blood sugar go up and stuff like that. So here are some more things that acupuncture can do. You can read the rest where it regulates our serotonin, our dopamine, all these things to help change our mood and impact our negative emotions. And it's really effective at stimulating the parasympathetic nervous system, which helps us to relax and be calm. And this is a biggie right here. This is a biggie. I see a lot of patients coming to my clinic because of this, peripheral neuropathy. And according to our medicine, this this happens when we have a blockage of energy. So remember how I said we speak a little different in Chinese medicine, but it still translates in the terms of Western. So this is like the energy, our qi. So our qi and blood in the body is being blocked. So if the qi and blood don't flow freely, our cells and tissues don't receive the nourishment that they need. So then you get these side effects, numbness and tingling, the pain, the discoloration, you can't feel your feet, stuff like that. So acupuncture is really good with restoring blood flow and stimulating the body's nerve pathways. And then also to help nerve regeneration and preservation. And so when I see a patient who has this, we put needles, well, I put needles in areas where it's close to the nerve, where it's close to arteries, or close to, where close to certain nerves where they can't feel, right? I palpate, and so I can't really feel that, I palpate. So I put the needles in those particular areas, and I use electrostimulation, and I stimulate them I slowly, aggressively start off slow, and I increase it. And so usually it takes about, depending how bad it is for the patient, but 6 to 10 visits. And sometimes people notice improvement after the first visit, but most times it's like 6 to 10 visits, you get improved circulation. They can start feeling the bottom of the feet better, feeling your temperature better. And so it has been proven pretty effective with some of the patients that I have. And there's studies showing it too. And I have it at the end of the slide. If you're the kind of person, of course, you want to see if evidence-based, and yeah, it's at the end. And then another concern people have is high blood pressure. That's the concern. And so there's a lot of studies that show that acupuncture can facilitate a significant reduction in blood pressure. So I do want to mention that in our medicine, people have high blood pressure for different reasons. So that's why we treat people differently. This is why for me, this is the beauty of this medicine, because it's not one size fits all. Someone has high blood pressure for one reason, and someone has it for another reason. And so we use different points. And like it says here, we put points in the wrist, the arm, different parts of the body, depending on why this person has high blood pressure and what we find. And so studies have proven that it helps to lower the blood pressure and lower the LDL, right? When you go to your doctor every 3 to 6 months, they're looking at your LDL, is it in good numbers? Because you have to have that in good numbers so that you won't have your risk of heart attack or stroke. And then fatigue. So of course, studies have shown and proven that acupuncture is able to increase the serotonin levels, which helps someone sleep, and it improves our mood, it lessens our pain, it boosts our immune system, and all of these are factors that affect a person's energy levels, right? And so there is a little bit more of an explanation of why that is and why it helps us to have energy. But notice that needle right there with the smoking moxa on it. Researchers have found that the application of warming the needles to help someone physically and mental fatigue. So that's why we use that a lot in acupuncture and Chinese medicine, but we're really stimulating and nourishing the particular organ to help with energy levels. And this is really effective along with other things that we do, like our dietary recommendations and our recommendations and movement recommendations. And people really do but they talk about this, sometimes they don't talk about it, but sexual health. I know when I facilitated a group, support group, this was a topic of discussion that basically took up the whole hour. People were candidly talking about this. For men, erectile dysfunction or not being able to, get up or last longer. And for women, of course, one of the biggest things could be yeast infections. And like we know, sometimes medications, they actually release a lot of our glucose, and it goes in our, urinary tract, and we urinate it out. So sometimes that environment can cause you to be susceptible to yeast infections. And so acupuncture and some herbs have been very effective in helping with this concern, especially with, acupuncture is really known for fertility concerns and also women's health. When it comes to vaginal dryness, especially bacterial vaginosis, yeast infections, and painful periods. And then also for men with erectile dysfunction, low libido, acupuncture has been really proven to help them and assist them with this. And since, and then also there's a little explanation, the next paragraph, about how we view reproductive health and sexual health. We really kind of look at the kidneys and treating that. And so I kind of give a little explanation of that, of how we approach sexual health. And so that's why I put down better kidneys, better sex. So we kind of really approach that. And we know that in our medicine, someone who has diabetes usually have some form of kidney deficiency, as we would say. So we try to support that as best we can with acupuncture and herbs. Okay. And let me skip over one. Yeah. So, so this is the last part where it says include an acupuncturist as part of your diabetes care team. And so here's a list of course, your care team. And I just mentioned, as you know, acupuncture and our medicine continue to become mainstream in America healthcare. As you see, like our evidence-based studies show that we're kind of starting to become a power to be reckoned with. Like we can help. Like we have, it's a form of medicine that can help people. And so I feel like it needs to be included in our diabetes care team. So I have like a diabetes care team here. This is kind of what I do. I advocate for this to be part of a person with diabetes, their care team. So again, you have your primary care, very important, your endocrinologist, your pharmacist, your dietitian, your diabetes coach, your foot doctor, your eye doctor, your dentist, your support group, close friends and family. And then I didn't add on here, but a mental health therapist and a fitness trainer, and then a licensed acupuncturist. So I feel like this is a great care team for anyone with diabetes to have, and I really do advocate for that. And right here are some references. You're probably like, well, I don't live in California. How can I see an acupuncturist? And in particular, I want you to, this is a link for acupuncturists of color, because we're a very small percentage, about 1%. 1%. Absolutely, yeah, we're very rare. But so if you go to blackacupuncturist.org, you can look and see an acupuncturist in your state and see that they possibly look like you or understand your culture. So blackacupuncturist.org, very important, because sometimes you don't feel heard, or sometimes it's a cultural difference, or it's a language barrier. So that's a good resource. And then also the next one is evidence-based acupuncture. So if you're one of those people like, okay, I need to know the evidence, I'm not just going to go. Evidence-based acupuncture has a list of all these research done and all this information on how this can be effective, and kind of explain to us in Western terms. And then again, you have all these references at the bottom that I referenced in this slide. And you can download this, I believe, download this slide, and you can click on those links so you can get more information. And the last part before I start answering some questions is Let's Connect. That's my website, naturalgazania.com, my Instagram, my YouTube. I do post videos on YouTube, snippets of like what I do. I do snippets of like diabetes tips and what herbs that's good for this and good for that. And so yeah, just come connect. And I love connecting with people. And thank you all for listening to my presentation.
Thank you so much. This is really good information, Gazania. I mean, you almost got me sold, right? But we've got some questions, lots of questions if you want to pull up your chat there, but I'll go ahead and read some of these. Alicia, I think I'm saying that, hope I'm saying that correctly, says, where did it go? What points can you suggest for self-acupressure?
Oh, you know what? Very good question. So if you look, I don't want to stand up. Well, it's that, if you look at your leg below your knees, so below your knees and the medial part of your leg, okay? So your knees, the medial part, the middle part of your legs, there's 3 points. You're gonna palpate down that bone. And usually when you feel the tenderness, it's one on top like right below the patella on the side, on the medial side. And it's called spleen 9. Well, you can look this up. You can Google it. Spleen 9, spleen 8, and spleen 6. These are key points that I use on most people with diabetes, because when you use these points and you stimulate them, they help to us in our medicine to strengthen the kidneys. So spleen 9, spleen 8, and spleen 6. You can Google that and press those points. It may be tender on you.
Okay, great. Thank you. Tiffany says, do you find that the addition of TCM practices that your patients are able to reduce or eliminate Western medicine practices and medications?
Well, you know what? I advocate for integration, and because I respect all medicines, and I believe that people need them, of course. Yes, sometimes people are I send them back to the doctor because sometimes they need to reduce their medication. Absolutely.
Okay, after.
And that's a good thing. That's a good thing. So it's like a partnership between me and their care team.
Great, thank you for that. The next series of questions come from me. I'm just going to be honest. What is the average cost of an acupuncture visit or package? And is it something that's covered by insurance? I don't think so, but I just wanted to ask that
yeah, because insurance is mostly covered with pain. You know, you have to have pain. So that's one thing I definitely want to work on, is advocating for other things. So, but we have to, you know, that's a whole nother topic. But the cost, it depends on your state. But the average cost of a session could be anywhere from $75 to $120. And sometimes you have, you know, or you can try community acupuncture, which is cheaper. It's more cost effective. And then of course, they have package plans. But yeah, it just depends on your state. But average is $75 to $120 for each session. That lasts like an hour or so. But community acupuncture, it can be anywhere from like $30 to $50 for like a community section. Which
okay, so now you got to tell us, what is community acupuncture?
Well, community acupuncture is where you have maybe like you have nice comfortable chairs and like a nice, and like maybe it's like 10 people in one big room, or 5 people. So you're getting treated at the same time, but it's more like they're doing like lower extremities, you know. So it's kind of more of a little quick treat, and but it's with a group of people if you feel comfortable with that.
Okay.
Yeah.
Okay, cool. One other question is one visit effective, or multiple visits required in order to receive the full benefits? So it's kind of like when I go see my chiropractor, one visit normally just usually doesn't do it. I have to go for a series of visits. Is that how acupuncture is as well?
Yeah, you know, it's similar. It's similar. I say it's like this. You come to me and you're like this. And then every session, you slowly unravel that paper and it straightens. And then you may take a little while to come back, and it kind of goes back. So maintenance is going to be required. It could be once a month maintenance. So it's similar, like you said, it's similar to chiropractor, because you say, well, how do I know? Based on your signs and symptoms, your tone, your pulse. I see that you're getting better. And then you feel like, oh, you're going to come once a month. You can come once every 3 months. It just depends on you and if you follow the recommendations.
Okay, great. Elizabeth wants to know, how can she find a reputable TCM practitioner near her?
Yeah, that's why I said you can look at blackacupuncturist.org.
Well, what if she's not Black? I don't know what color Elizabeth is. So how can we just find a reputable practitioner, period?
Well, you know what? This is what you can do. You can go to, when you Google the state board, like California has a state board, Texas has a state board. You look at acupuncture state board, and then they have a list of like everyone who's credentialed, who's licensed, and anybody who's licensed, you know, can perform effectively, and they're taught everything that we know. Now, you know, sometimes people, you have to find someone who fits your style, your vibe, because not every acupuncturist is created equally.
And I bet everyone is not quite as fun as you are either. Thank you so very much. I think it's Macau's, and I tried community acupuncture for the first time, and it was very relaxing. I might have to Google that myself. Are there any other questions or comments for Gananza before we end our session? It's been really informative. This is a topic I don't normally see at diabetes conferences, so I'm so glad we were able to include something a little bit more specialized.
I was kicked off a couple of minutes ago and my power went out. This is recorded, correct? And I'll be able to go back and listen to this end part that I missed.
Yes, Elizabeth.
Okay, great. Because I tell you, this has been so informative and helpful to me. I was looking forward to this one and I was not disappointed.
Neither was I. Thank you so much. And thank you for being with us all day. I've seen your name all day long. So we're going to go ahead and conclude our session. Again, thank you so much for your time, Gazania. Great information. You've given us all something to think about. We're going to go ahead and conclude our session now at 3 o'clock. We have a semi-live session. That topic is going to be diabetes, co-designing for Tequity. And so if you're interested, just go ahead and click join there. That session is going to start automatically. We're going to end today's summit on a very kind of maybe controversial topic, remission versus reversal. That is the question, and that's going to start at 4 p.m. Central Standard Time. We hope you can join us for that. But that's all that we have, and we will see you hopefully in the next hour. Take care. Have a great one. Let's stop that recording.